Over 45 million people have no health insurance in the United States, and many others are classified as underinsured. While the incoming Obama administration is facing a slew of problems on the foreign desk, healthcare is a domestic crisis.
For 20 years, Washington's talked about healthcare reform and reformed nothing. I've got a plan to cut costs and cover everyone. But unless we stop the bickering and the lobbyists, we'll be in the same place 20 years from now.
If citizens are ready to take Obama at his word, Obama seems ready to hear their voices. His healthcare transition team is convening community groups all around the country, and now they've even come to the virtual world of Second Life. Colorful avatars, virtual representations of real people, had stories aplenty on how the difference in quality and care impacts their lives. Deirdre Amufaz is a registered nurse from California.
The structure of the healthcare system that is based upon profits of private companies rather than a focus of healthcare itself. I hope that someday we can change that.
There are low-risk procedures available for Omaha, Nebraska resident Dory Bernstein's rare genetic disease, but her provider still won't pay for them. And this isn't Dory's only problem.
I have an autistic son on the mild to moderate end of the spectrum and needing therapy. I have to keep myself either on welfare or better find a sugar daddy to support me because you're looking at good $40,000 a year for therapy cost.
Hylonomy Quintessa is a cancer survivor from central Indiana receiving Medicare. For her, the crumbling healthcare infrastructure means very little choice in which doctor to see.
There's only one dermatologist and you have to drive there. You can't take any public transportation.
Denver, Colorado resident Gentle Heron has multiple sclerosis. She runs Virtual Ability Island in Second Life. On the question of how any given healthcare proposal under Obama should be financed, she focused on affordability.
Ideally, the employer's role is simply to pay me for my work. From my salary, I should be able to afford my health care, and I also should be able to understand how to get the health care that I need.
Towards the end of the 3-hour discussion, Cotton Thorne, an educator from North Carolina, even suggests an option which used to be almost unmentionable until the banking crisis put the federal government in control of major corporations.
I think some form of basic coverage supported by a national system. I know, it's a national system. But then extended coverage for people who need/want it.
Since the presidential campaign ended, the Obama team has reached out to volunteers asking them to directly shape policy on various topics using new media to facilitate this goal. Organizer Siri Vita came up with the idea of transplanting this citizen momentum into SL.
One of the most amazing things was how willing people were to open up with their personal stories the way they might do it in real life in someone's living room. They really spurred the discussion to a much deeper level.
Siri Vita is Susana Matukas in real life, a former ad agency executive. Her idea of using a virtual world instead of a neighborhood cafe to bring citizens together worked out great, she says.
It offers access to people who ordinarily would not be able to get up and get out and go to a meeting in real life. People with disabilities and chronic illness. People whose life is truly impacted by healthcare policy in America. Here they are and have their voices heard.
Siri says the kind of change Obama supporters envision can be facilitated by the Second Life platform through real-time interaction.
There are so many interested parties that don't have the time, travel on business, have childcare issues, can't get out and spend 3 hours in the evening to go to a meeting. This gives everyone a chance to participate.
Siri's report on the discussion's findings will be reviewed by the newly appointed Secretary of Health and Human Services, Tom Daschle. So what is the potential of Second Life for the Obama administration? A platform affording unprecedented immediacy, creating communities that are global in nature but have deep local significance. What would prevent President-elect Barack Obama to show up in virtual form himself? Perhaps the isolated incidents of security breaches? I can understand, but Mr. President, trust me, this won't be a problem. You enjoy Secret Service detail and what we call real life? In Second Life, we have another powerful protective force. The Justice League is always just one instant message away. From Port Spinoza in Second Life, I'm Drexter Dupre.